Good morning, everybody. I'm absolutely delighted to be here today with the many hats that I actually wear as leader of the council, leader of the place of Cheshire West and Chester Council, chair of the Healthcare Partnership, which is a really important partnership that's working so closely together across all our partners within our system. But also I chair the Local Government Association Children and Young People's Board, and smoking is one of our areas of focus, working very closely with our community and wellbeing board. So adults and children's services working together. So this is a particular passion of mine. And we do have a vision, we can see here. We have a vision of an altogether smoke-free Cheshire and Merseyside, a future where people will eventually stop smoking, and it will enable people to live longer, healthier, happier lives free from tobacco harm. So, some of you will know about our work, our All Together Fairer work, really important for us as a healthcare partnership. This All Together Fairer strategy, which is about health equity and the social determinants of health across Cheshire and Merseyside, as you know, was successfully launched at a wonderful event in May 2022. And commitment has been made across all 9 health and wellbeing boards to the recommendations and for us all to become a Marmot community. The Health and Care Partnership has formally adopted this report as our strategy for Cheshire and Merseyside for 24-25. The report recognised that smoking is still one of the key drivers of ill health and inequality in our area. Our integrated care system, NHS Cheshire and Merseyside, and the 9 local authorities are required to have regard to the healthcare partnership strategy when making decisions on commissioning and delivering services that impact on people and their health and care. Collaboration and cooperation is crucial and key to our success. Tackling smoking is essential to meet the key aims of our integrated care systems across the country, including all 4 statutory aims, which are about improving outcomes in population health and healthcare, tackling inequalities in outcomes, experience and access, enhancing productivity and value for money, and helping the NHS support broader social and economic development. The Cairn and the Hewitt reviews have reinforced this, as has the recent major condition strategy. Today, you're going to hear from a range of wonderful speakers about the importance of this work and the value of regional programmes, including the director of the Fresh programme in the North East. This work is about reducing admissions and readmissions and saving millions for the NHS, but most importantly, it's about saving lives. I want to share a short film with you about Davey and his mum, Maggie. Fresh have been able to inspire and support so many people to quit by telling the stories of people in their communities. I hope as we embark on our journey, we'll be able to do this too.
The day I found out I had mouth cancer, I was really shocked. I'd never even heard of mouth cancer.
I was about 12 years old, and that's when I came home and my mum sat me down and she said, "Look, David, I've got mouth cancer. I'm going to have an operation." I just remember the C word, I just fell apart because you just expect the worst every time, don't you? So they took a big chunk of the roof of her mouth out, and she had an obturator that she had to put in after that. When she first put it in, it was so hard for her to get used to. She couldn't talk properly, but we had a long, hard battle after that, and we got through it together. It was quite a hard time for me. All she wanted to do in her life was to help people. If she could help just one person quit smoking, it would make her so happy. The fact that she got to do the campaign and raise that much awareness was just absolutely unreal. And the amount of support that I've received since, and the amount of support that she got from, she's told me about messages that she's got from people all around the world who have said they've quit smoking after watching her ad, and it was very powerful. I think it made an impact with a lot of people. I was so proud of her, I really am. Obviously now that's just passed away, I'm the only one left to continue her legacy, and I think it would make her extremely proud if I could make one more person quit, or if I could be an inspiration to someone else who was thinking about quitting, because it's possible, it really is. Just before my mum passed away, the last conversation I had with her on FaceTime was actually me with a vape saying, "Oh, look, Mum, I've quit smoking." So I've been off the cigarettes now since 2020. She died knowing that I quit, so that makes me happy. It's been a motivator for me to continue to not smoke. Well done, Mum. She makes me so proud.
So you've heard there from Davey about how Maggie's story touched so many people in the North East. And I hope we'll be able to tell the stories of the many people across Cheshire and Merseyside whose stories tell of the harms of tobacco, like Maggie's, and like Davey's, of the hope that quitting soon enough can offer to transform your life. And now I want to tell you a little story. So today is a special day, April the 23rd. It would have been my dad's 93rd birthday, I think. This is him here. That's me with my nice brown cardigan. I didn't wear pink there, and that's my sister who looks particularly miserable. And that's Keith. That's Keith at the back. She doesn't know. She's a midwife now. She doesn't know I've shown this. So that's my dad, Keith. And tragically, he smoked all his life. He was a care leaver, and he was an alcoholic as well. So he had all of the traumas, if you like, of being a care leaver. But he smoked all of his life. He smoked a pipe, which used to drive us mad, and cigarettes. And sadly, he died of smoking-related lung cancer when he was just 68. He didn't see his grandchildren grow up. He never saw me be a politician. I'm not sure what he'd think of that. But he missed out on so much of his life. And my husband's dad, Jim, he died of smoking-related lung cancer at age 69. And they were a generation where they didn't know any different. They smoked from when they were really young children. It was the thing to do then. And so for me, this is my real passion, so that other people don't have the pain that we went through when we lost my dad. As difficult as he was, I loved him to bits. And I love this photo because that's how I remember him. And that's how I remember me in my lovely brown cardigan and strange hair. So I think, you know, I can speak fondly of this, but I think all of us have got stories that we can tell, and I think it's really important. And certainly for me as a politician, we are leaders of place, whether it's for the whole council or for the ward. And I'm really proud that our cabinet membership, I thought she was going to be here, Lisa Danson. She's given up smoking. She's got public health in her remit, and she wants to lead by example. So if there are any sneaky smokers in here today, then that's perhaps something that you want to think about. Anyhow, I'm going to hand back to Ruth now, and I hope you enjoy the rest of the morning. Thank you.